Ray Anderson is off to build another bridge today. She's a quality management nurse who helps connect 40 medical practices in Riverside, California, to their IPA, Riverside Physicians Network, where she works. Her role? To assist providers in meeting the ever-changing requirements set by today's healthcare plans.
RPN tries to help with the office level morale by being as supportive as we can, by trying to take some of that work off of the office staff. If I can access the medical records for that office staff, I'll go in and do that record chase. I'll print off educational materials for them. I will bring them pens and Post-its. I mean, whatever I can do, I try and do.
And when Ray's not helping, she's educating.
I go to the office staff and I give them the gold standard. If there were no limits, if there were no problems, this is the goal.
But there are limits and problems faced by practices here and around the nation.
There are increasing administrative responsibilities, documentation standards, quality initiatives that are based around preventive care measures for the patients. And most of that responsibility falls on the physician and his practice staff. We're here to support that entrepreneurial physician. And I think that that's a very important concept.
Sandy Derryberry leads the RPN team tasked to provide that support. Early on, she realized that in order to create change across the practices, they had to create change internally at RPN. Her CEO agreed.
The offices went from 5 years ago saying, stay away from us, get out of our practice, you don't own us, now to saying, hey, we're overwhelmed, how can you help us? We wanted permanent change, systemic change in the company so we can offer it to the independent practices.
One of the ways to solve that was for us to enter the PTI Quality Care Collaborative project.
PTI, the Practice Transformation Initiative, is a program providing support and training to provider organizations throughout California.
PTI gave us the tools to begin, gave us the permission to be introspective and to cut down the barriers with the offices.
Our approach was learn how to do it internally and then push out a best practice model. And we used a few gatherings of primary care practice, key office staff and office managers, where they could sit at a round table. They could share their frustrations. They could share ideas with each other. Tell us what works, tell us what doesn't. Some of the most creative ideas come from practices.
Those ideas were the seeds of system transformation. And the meetings launched collaboration throughout the network.
There are so many regulations that like 5-star and annual assessments and other performances that we have to do. It is almost impossible to do it by ourselves. And RPN was crucial in helping us out and providing tools to do it.
Dr. Raj Sinder has been practicing medicine for more than 30 years. He welcomes RPN recommendations.
Patients having diabetic checkups every 3 months. Okay, we didn't do that because there was no way to capture that. Now we can capture it. Every female patient gets a mammogram after 40 every year. That's standard of care. If you came in and you have not had a mammogram, you'll get a mammogram slip that day. So those kind of things that we have implemented have improved the quality of care significantly.
And there have been improvements across the board among RPN members. A reduction in hospital readmission rates and in ER visits, an increase in certain levels of care, and positive results related to chronic care management programs. Sandy says they're just getting started.
It's always going to be an inside-out approach with testing at the primary care practice level. Test with physicians, test with staff. Do we think this is going to work? Where do we need to modify? And my goal is that everybody understands the customer and delivers the best experience possible.
Running a practice and running a practice effectively are two different things. That takes a teamwork. So RPN, I think it's been our, I would say, a lifesaver. We couldn't do without it.
It's what motivates Ray as she traverses traffic on her way to her next office visit.
If I can help the offices provide better care to their diabetics, if I can help them vaccinate more kids, if I can help them screen more women for breast cancer, then that would be a good day.